Last week, a very prominent social media personality in the medical community posted a video asking his followers, of which there's almost 500,000, why more often than not when he enters his patient's room, if it's an African American patient, why they're always on their phone. Now this video was met with extreme backlash, and rightfully so. The video was then taken down and an apology was issued. However, I have some thoughts about this. Let's get into it. Before we get started, I want you to know a little bit about my background. I'm a physician, I'm an anesthesiologist, I'm a son of two immigrants who came from Pakistan with very little money in their pockets, established a life here by working hard and following the rules. I'll get back to that, but just keep that in the back of your head. I've practiced all over the country. I've worked in the Midwest, I've worked on the East Coast, and now I'm working on the West Coast. I can tell you that racism, both prominent and subjective, is still present in the medical community. Now, what you need to know about medicine in general is that medicine is very slow to change. What I'm here to present is an explanation for why these things happen. Now, in order for you to understand where this is coming from, let's take a step back. How does medical education and medical training work? Well, medical education and medical training is an apprenticeship model. This means that you learn under some more seasoned physicians and they teach you everything. They not only teach you how to perform certain procedures, how to take care of medical problems, they also inadvertently teach you their own biases that they were taught by their predecessors. This is why in medicine it's so hard to change norms. You can see a blockbuster medication come out but take years to get into practice. That's because as doctors it's very hard for us to veer off the path that we were told to follow. So if you know that you treat blood pressure with this medication, you treat diabetes with this medication, you follow that to a T, and it's very hard to change. Change isn't easy in medicine. As you know, up till about 10 years ago, it was common knowledge that medical professionals thought that African Americans typically have higher pain tolerance. It was also thought that African Americans have tougher skin. It was also taught that African Americans are more needy, addictive behaviors, issues with controlling their anger. Now, all of these things now, looking at it from 2024's perspective, we know is wrong. But back in the 70s, back in the 80s, it was anybody's game. Now, remember that thing I was telling you about in the past? Let's talk about me for a second. As a 36-year-old male, child of two immigrants who has lived through 9/11, the housing crisis, multiple wars in the Middle East, and the other socio-economic issues that have affected my generation, I was always taught as a kid to stay in my lane, not express my opinions, stay within my boundaries, don't make a lot of noise, don't draw a lot of attention. After 9/11, it was amplified even more. I was a freshman in high school when 9/11 happened. The ramifications psychologically affected me for years to come. It forced me to develop personal skills, social skills to avoid confrontation. Because what people don't understand is when you are the son of an immigrant, when you are a child of an immigrant, those parents who came from across the world, the last thing they want to do is have to go back to that part of the world. They gave up everything. They made a risk. They took a risk. They came across the ocean with a little bit of money in their pocket, a very hard-working soul, honest personalities, earnest personalities who just want to make it, succeed, and have a better life for their children. And as I went through high school and college, I was always subjected to the same type of rhetoric: terrorist, brown guy, other more horrible words. And those words at the time didn't affect me the same way as they would affect me now. They did, unbeknownst to myself, change my personality, so I became a lot more adaptable. I wanted to move with the current of the water. I didn't want to make a lot of noise, didn't want to express my opinions. Because of this, anytime I was questioned or subjected to any sort of subtle racism, subtle discrimination, I would always laugh it off. Because nobody is going to ever ask a white male, "Where are you from?" And that's a take-home message, because as innocent as that sounds, when you ask someone, "Where are you from?" it shows, unbeknownst to you, that you think that that person is not from America. Now, I was the son of two immigrants, like I said. I was born in the United States. I consider myself an American. However, for the majority of my youth and the majority of my life, I've always had my nationality questioned. And I bring that up because I'm not bitter about it. I'm not upset about it. It doesn't bother me anymore. I've gotten used to that question. I've gotten used to other questions in the same subtle type of way. Many people don't think about that. They don't think about what they're saying, the words that they're saying, and if there is any subjective meaning that they've been inoculated from their predecessors with. And this is especially important in medicine because a lot of the education that we get is on-the-job training, mentorship model from individuals who are usually significantly older than us, and it takes a lot of time to break those cycles. Because America itself is looked upon as the beacon of light in the entire world. Why? Everybody wants to come to America is because it's an amalgamation of all the different races, ethnicities, ethnicities and cultures from around the world, and we bring the brightest and best here, and we create an example for everywhere else. And that's what makes America strong. And the problem is that sometimes we get stuck in the rudimentary thinkings of our predecessors that were years and years and years before us, who were raised in a different time. And little things, day-to-day things, questions you ask your patients, they can affect not only the patient, but the way you approach them as their physician, as their nurse, as their tech, as their hospital employee. But it's up to us, the new generation of physicians, new generation of nurses, new generation of techs in the hospital, to think about these things. We have to be aware of these things. You have to think about what we're saying and if it's going to affect the other person. And the only way you're going to know that is if the other person tells you. As South Asians, as Asian Americans, as sons and daughters of immigrants, we've been conditioned over years and years and years of not bringing these things up. Now, in a time when diversity is being thought of as a negative, we should, as physicians, as a medical community, be actively thinking about these issues. I'm not saying that DEI initiatives are good or bad, anything like that. I'm talking about you, the person who's viewing this video. You, the physician, you, the nurse, you, the tech, whoever's looking at this video. We have to understand that at the most basic level, we are all human beings. We all bleed the same, we all breathe the same, we all live the same. And yes, our cultures, our ethnicities, our backgrounds might be a little different. However, that does not make them wrong. It does not make them bad. It does not affect their day-to-day life. So I wanted to take a second, as a son of an immigrant, a father and mother who came across the ocean with a little bit of money in their pockets, who always taught us to do the right thing, who always taught us to never break the rules, study hard, and become successful. That yes, sometimes words can hurt, even if the person who's receiving it doesn't